Hello guys, welcome back to my YouTube channel. If you're new here, please subscribe, hit the notification bell so you're notified every time I post a video. And if you're a returning subscriber here, you're most welcome back, and thank you so much for always supporting me. May God bless you abundantly. So yes, I've been trying to shoot this video and the funny thing the worst keeps happening. Yeah, my light just stops out of the blue. So last week I just had to go on and shoot without the lighting, and then during editing I noticed that the video was a no and I could not post it, and that's why we did not have a video last week. So guys, forgive me. The struggles of content creation are on another level. So yes guys, today I'll be talking about the most challenging or the hardest thing in medical school. And of course, this analysis of mine is not just based on my personal opinion. I also have evaluated and then found out that this particular year is the hardest when it comes to the Russian education system. And of course, when you compare it internationally to countries that have 5 years of medical school, you notice that second year is the hardest for them. However, for Russia, I think most of the time it is known that this particular year is the hardest. Talking about the hardest year, of course, I am not downplaying the fact that most of the years in medical school are very complicated and very hard. However, with this particular year, I found out that the pressure was a lot, and it was a new kind of pressure that we needed to adapt. And this particular year is the third year of medical school. I don't know, well, I'll try to break down the things that make it actually one of the hardest years in medical school. However, I will also try to go through the different years in medical school and how Russia takes it. So talking about third year being the hardest, let's go through the different years of medical school. So when it comes to year 1 and year 2, these are preclinical years where we learn anatomy, we learn physiology, we learn biochemistry. You have things like chemistry itself. So all of the things are just preclinical, preparing you for the actual game or for the bigger things. And then when it comes to third year to fourth year, these are now the clinical years where you learn the topographic anatomy, you learn physiology, pathophysiology, you learn pathoanatomy as well, you learn internal disease or an introduction to internal diseases. And all that kind of built up because these are very different subjects, or the analysis, the analogy you have towards the subjects is totally different, which just makes it very hard. So with third year specifically, now talking about transitioning from second year, which was the preclinical year, to now the third year, which is the clinical year. So that transition is a bit very complicated and very hard, in that in first year, second year, you're just learning anatomy. The teachers were asking you where is the liver and you're pointing at the liver, or the teacher was asking you where is maybe this particular bone and you're pointing at maybe the femoral bone or the humerus. But now in the clinical years, you're learning the pathology of things, your anatomy. So with all those things, there's a kind of difference in them, in that previously you're just learning the liver as a liver, but now in pathological anatomy, you're learning the pathologies in the liver. You're now going so deep into the cells of the liver. You're seeing what happens with the liver, and why does the liver look this kind of way? Why is the liver called nutmeg liver? So if it's called the nutmeg, it's because this pathology has affected it to the extent that it now looks like a nutmeg. So all those kind of things now come in third year. And then when you look at subjects like pathophysiology, previously normal physiology, you're just learning about almost normal things, the action potential, what triggers the action potential, all those things. Then transitioning to pathophysiology, where you're now learning the pathology of the normal function of the body. I mean, if the body doesn't function well, what happens and what kind of signs do you see? It was a bit hard because we came from a place of maybe cramming or just knowing facts to now the place of having to think like the doctors, having to walk through the process, or having to walk ourselves through the different pathologies that our patients are facing, if that makes sense. So that transition was a bit very hard for us. And then coming to subjects like pharmacology, that was where we totally saw that this was a different language on its own. Yeah, leave alone the Russian language, but pharmacology on its own was a different language. We came to a place of learning different kind of drugs, having to cram them literally, and not just cramming, and also knowing how they act in the body. You had to know different NSAIDs, you had to know antihypertensive drugs, you had to know, or maybe drugs that are just working for the kidney, diuretics. Or when you start mentioning all those drugs, you feel like you're speaking not Chinese, of course, but you're speaking a totally different language. So pharmacology was a totally different language. And then, of course, we had biochemistry, where we were learning elements, where maybe the organic chemistry and all those things, and how the different chemicals operate in your body. But now when it comes to pharmacology, it's now where you're learning the drugs one by one, and you're seeing which one is helpful and which one is not helpful. What are the side effects of these drugs? How does this drug operate in your body? All those kind of things. And of course, it was a bit challenging. And then coming to subjects like internal disease, I don't know how to start with that, because for me, I honestly felt like the subject wasn't that hard, but the pressure that was inflicted in us by the teachers just made it very complicated, because we found teachers that wanted us to study for their subjects for like 3 days, of which every subject in third year is very demanding already. How do you expect me to study your subject for 3 days? It means if I'm studying your subjects for 3 days, I'm not going to concentrate on topographic anatomy, I'm not going to concentrate on pharmacology, so that just makes it hard. So when you have a hard teacher that is so demanding and wants you to do this particular subject their way, it becomes a bit a no-no. Yes, that was it for internal disease. And of course, that internal disease on its own was like a world on its own. We had times of having to learn how to take patients' complaints, how to make a patient's history, all those kind of things, coming up with what, and then having to learn different symptoms in the body. For example, pain. If someone maybe has pain in the stomach, does it mean they have stomach issues? Yeah, internal disease will not explain to you that no, they can be from any part of your body reflecting to another part. So pain is not like a constant thing that is just a subject that, okay, I feel pain in this particular region, that means it's peptic ulcer maybe, or this and this. It could mean different things. So internal disease was the subject that was helping us to now differentiate those kind of symptoms and all. And then another thing with internal disease, it was a subject where we had to now interact with patients, of course, like I said, where you had to take the complaints of the patients, where you had to now see, okay, based on these complaints, what diagnosis can I give my patients, and what lab tests can I suggest for my patients, what instrumental tests can I suggest for my patients, and how can I read and interpret this lab and instrumental examinations, and then finally what kind of pharmacological treatments can I give my patients. So all those things were in internal disease. And of course, seeing it for the first time, knowing that every other subject is demanding for your attention, just made it hard. Of course, it was a very interesting subject in that we felt like doctors. That was the first time we had to move around with our stethoscopes and all those things. So it was very exciting and it was something that we're looking forward to. And it was in those subjects that, I mean, in internal disease, that the teachers were calling us doctor this. So we really felt like, yes, we're on the right path. And yes, like we already said, that the teachers were not calling you doctors for nothing. They were demanding information from you, and in return calling you doctors. So it was not child's play. And then, yes, I have not yet gone to the exams themselves. And then talking about surgery, I don't know what was going on with that particular department, and I wish my university is actually watching this. Yeah, somehow I think the department needs to do better, because their structure, first of all, was not helpful for students. I felt like there were a bunch of teachers that just did not want to do or did not really want to teach the students. We sensed pride, we sensed arrogance, we sensed a lot of different kind of things. And I don't know if I should explain this, but I remember my first assessment in surgery. I went, and of course during classes there was this intimidation, there was this bossiness from the teachers, there was this silence passage of information trying to tell us, you know this, don't come here. So, and of course with all that, I went for my assessment very intimidated, knowing that, okay, these are people that don't really believe in us that way. Okay, at least me, let me not speak for the others, don't really believe in me that way. So I went for that assessment. I remember sitting down before the examiner, and then the examiner asks me a question. And of course, I am not that unserious to just wake up in the morning and go for an assessment. I had studied myself throughout that week, knowing that we had this assessment. So we went for that assessment, and yeah, they just asked me a question that I for sure knew that I knew the answer, but somehow I just froze. I could not answer anything. He asked the second question. I'm just looking at him like this, and I am shivering. Trust me, if you're someone that is kind enough, you could tell that this girl, it's not because she doesn't know, it's because she's maybe afraid of me, or maybe she's not comfortable with me. So can I give her a break? There was nothing like that. I just stood up from that chair. I remember crying myself out through the metro, through everywhere. I just kept on going, like crying. There was this imposter syndrome that came on. There were a lot of questions, me trying to ask myself, can I really do this? Am I in the right place? Thinking through, and like I already said, that third year is where every teacher is putting pressure on you. It's like a filter here. It's where they are trying to see if you really are meant for this. So the pressure comes in that if you really believe this is the path you should take, keep on going. If you do not believe, if you're shaky about, if you're doubtful about your beliefs, then get out. And it was in those moments where I could have made a decision of saying that, you know what, goodbye medicine, just because of one subject, and not because the subject was actually hard, but because the teachers were just messy. So yeah, I went home. I had all those kind of things. I had my time of crying. I had my time of this and this and this. By the grace of the Lord, we overcame, and we continued going. And another thing that really pained me during that particular season was the fact that this assessment, I could only redo it at the end of the semester, and that meant that I had like 3 months of thinking, of living with the guilt that I did not pass this assessment, or I went timid in front of the teacher and I did not answer it. And there were just moments of me thinking to myself that, oh, I don't think you're that intelligent, I don't think you're that wise, I don't think you can really continue with this. And yes, and it affected every other thing that I was doing in that particular year, in that even if I went for pathological anatomy assessments, I always felt, oh my God, I have not finished my surgery, all those kind of things. But yeah, by the grace of the Lord, we finished the assessment. And I remember going actually for that assessment, and I answered so excellently. I gave the teacher everything. And then the teacher just got mad. I was like, okay, why are you coming on this particular day? Why didn't you pass it the first time? Like, bro, this was the same teacher that had taken me the first time that is re-examining me, and now I'm speaking, I'm giving all the answers. You're saying, why did I pass this the very first time, and therefore I'm giving this kind of marks. I was like, I don't care, like, bro, just give me the marks, let me go. Yes, that happened. I am not even talking about the exams yet. I am not. So yeah, there was this hardship that came from the subjects themselves. There was the hardship that came from the teachers themselves. It's like all the very complicated teachers, very stressful teachers who were all in this particular year. Yeah, all of them were in third year. I remember one time my friend was doing a research, and therefore he needed someone to go with a altimeter for 24 hours. And I remember a altimeter is like a blood measuring machine that measures your blood pressure for 24 hours. And therefore I went to this altimeter to class, my pathophysiology class. And usually, because I am small in size, and therefore my blood pressure usually doesn't even reach 120 over 80. It doesn't. So that particular day it went up. It doesn't, because I mean my body is small, it's almost proportional to my body, so it makes sense, it's not pathological. So that particular day my systolic blood pressure went up to 200. I recorded in pathophysiology class. So that is how stressful the teachers were for us, in that they were demanding a lot. You must know, like, why don't you know? You must know. And I already spoke about pathophysiology in my other video. I spoke about the hardest subject I have had to survive in medical school. If you've not watched that video, please go and watch it. So yeah, those are some of the things that we had to face. And coming to the exams themselves, yeah, the exams were very challenging, in that some of them, they were totally new kind of tactics that we had to apply. In that, for example, for internal disease, this was the very first time we had to examine a patient, and of course, due to different circumstances and different things that happen. We did not really have access to the actual patients, but the teachers themselves had to examine us. Yeah, and I think it was proper that way, in that they did not have to allow us just go to the patients without seeing how we do it for the very first time. So it was proper that they examined us themselves. So for that particular exam for internal disease, I remember as soon as you enter like this, the teacher who is your patient is looking at you the way you've entered. Have you greeted your patient? You have empathy. How are you communicating with the patient generally? So as soon as you enter like this, of course you should greet the patient, and then the patient keeps on going. I have diarrhea, maybe I have fever, I have headache, and this is happening, my blood pressure is high. So as the patient is giving you those complaints, you have 2 minutes to ask extra questions and then come up with a diagnosis, and then recommend your lab and instrumental examinations, recommend your pharmacological treatment for that particular disease. So you have 2 minutes to do all those kind of things. And also your marks come from the quality of questions that you ask your patients. So all those things, of course, the teacher will not immediately tell you know what, you got your diagnosis wrong, because they want to see how you're flowing with everything. And then at the end of the day, they will tell you that okay, your diagnosis was right, but the questions you asked were weak, or your diagnosis was right, but the treatment you gave was wrong. So those kind of things. That's why it's called propaedutics, because it's like it's ushering you now to the clinical years where you're now going to be interacting with patients and all those kind of things. So yeah, there was that exam, and I remember we left our house, like our hostel of course, like around 7 a.m. and we came back home close to 1 p.m. That is how long the exams were. So we had that patient doctor interview. Then we had the part where we had to interpret the blood, the different the laboratory examinations. We had the time to interpret now the ECGs. We had the time to write the system test. So all those kind of things. I'm like, why in one subject do you have all those kind of things? Because in first year, second year, it was just take your billet, maybe show me this particular thing on the cadaver, or maybe it's biochemistry, take your billet and answer it for a few questions and then give it to the teacher. But now we have to defend ourselves in front of these doctors, and that really made it a bit challenging. However, I am going to go ahead and speak about some of the things I wish I had done to make third year a little bit better for me. Number one, finding your people is a very important thing to do while you're in third year, because this really helps you. And coming this far, I have noticed that a lot of times we as medical students compete against each other, and that is not really helpful, because even if you're the best doctor, you're still going to need other people. So every international student, or all your classmates, as you see them, do not see them as competitors. See them as people that can help you. See them as stepping stones for you to get what you do not have. Yeah, so if you do not understand something in class, go to your friend and ask, how did you understand this particular topic? And you explain it to me. Do not, like, letting away pride is very important, because you cannot succeed in isolation. You need one another. So I would have done that more. I'm not saying I did not do it. I did it, but I would have done that more. I would have done it on every topic if I went back. Yeah, apart from finding your people, it's also important to just embrace all your weaknesses. Embrace your insufficiencies. For example, if you find that this subject is not my strength, embrace it and do better at it. Do not try to, there's this thing of wanting to be good at everything, like a superstar. You're superstar here, superstar here, superstar here, just trying to show outward there. But there is a need to actually do an inward reflection, where you see that, okay, when it comes to pharmacology, it is not my strength. I am not a good crammer, and therefore I need to give my extra time to this particular subject. And when it comes to pathophysiology, maybe it is my strength, and therefore I'm going to go to class and listen to the teacher attentively, so that when I come out of the class, I don't need to go through the notes once again. So accepting your strengths and weaknesses really helps and goes a long way. So that you stop to major on the minor and take the minor things. I don't know how to put that statement right. I tell you, get my point, yeah? But yeah, knowing your strengths and weaknesses really goes a long way, and it saves you a lot of time, in that when you know that this subject is your weakness, you're not gonna spend hours and hours trying to understand it. So as soon as you're done maybe with that particular class, you go to a friend and ask, how did you do this? How did you understand this particular thing? So it really saves a lot. So that was it for me. And another thing that I would have done, or I would advise anyone to do, is to just embrace family, embrace friends, create friends outside medical school, guys. You don't want friends that are always talking about hypertension, talking about cholera, diphtheria. No. So a lot of the, and this is really one thing that I know really helped me, because most of my best friends, most of my friends were actually outside medical school. These are friends that I found in my church, and every time I met them, maybe on Sundays, Saturdays, over the weekend, I really felt like, this feels good. Like, I'm not hearing anything that is maybe myocardial infarction, I'm not hearing anything that is tuberculosis, I'm not hearing anything that is nutmeg liver, all those kind of things. So that kind of difference in conversation, and the fact that they're talking about something that, they're talking about things that are totally different, really brings a relaxation to you and makes you just feel like, I can breathe for medical school. So yeah, if you can find friends outside medical school, is very important. Yeah, it doesn't mean that you have to neglect your friendships that are maybe your classmates and all those kind of things. You need them, be okay with them, yeah, but also do not neglect the people that are outside that are non-medical students. You need them, because you just need that difference in atmosphere. I personally don't like when I'm moving, maybe by the elevator, and then someone is asking me, oh, are you school? Oh, are you ready for tomorrow? That is actually the language of in the hostel. Every time you meet a medical student, oh, have you done this person's assignment? When shall we rest? It's a weekend. There's a reason as why it's a weekend. Can you just not remind me of that? So my church really helped me a lot with this one, in that every time it was a weekend, it was time to relax. It was time to like, finally, yeah, I can breathe. And of course, I had friends that went to the same church but are also from the medical department, from the medical field, and we knew totally well that this communication or type of talk is very toxic. So when we're at church, we don't talk about school. Like, leave school out of it. Maybe if someone needs help, then we'll say that, oh, please, can you send me this file, things like that. But when we're at church, we are talking about other things outside the medical field. So yeah, your community is very important. Do not neglect. If it means even once in a while calling your family, it's very good. Call them, gist with them, this and this and this. So all those things just enable you have a break from the pressure, and there are a lot of things that are going on in the medical school. And then also I want to talk about the fact that you should not neglect your mental health, because it's very important. These are years where people usually break down. The years when a lot of people forget their whys, which our next point is, do not forget your why. Yeah, a lot of people forget their whys, and it just takes them to a place of torment. I remember one day I was praying by the stairs, and then there was this girl. She came crying. I did not really know what was happening, but because it's my university, I had to know. I had to know that it was related to school, and I just had to close, because it was a Zoom meeting. I closed everything. I put my tablet aside and I went to her. I just hugged her, and to me I was like, Lord, help her, because in this journey, or in this particular university, Pirogov, you need God to survive. I hugged the girl tightly. I said a prayer unto her, not of course loudly, because I knew she was from a different faith. She was a Muslim. So I just hugged her and kept on going like that. Like, the hug was long, up to the extent that she stopped crying, and by the time we were done with the hug, there was a smile on her face and she felt comforted. Yeah, so sometimes a hug is all that people want. So yes, if you can extend that grace to people, and just know that the environment around the medical institution is just very depressing, you just try as much as possible to make sure that everyone is okay. Not everyone, of course. Those ones around you are okay. All I was saying is that do not forget your mental health. It's very, very important. And then also, like I said, that our next point was know your why. Like I was saying, our next point is know your why, because I had several moments where I had to remind myself where I come from. I had to remind myself that, okay, Tina, you know what, when you graduate, you're gonna be the first doctor in your mother's family. So all those kind of moments just made me continue to keep on going. And I also knew that if I stop, if I drop out, or if I get pissed off by the pressure and just leave, I'm going back to nothing. I'm either going to get married maybe and give birth to children, or I don't know, just end up in a messed up kind of life. So I just had to keep on pushing that this is it. It's discomforting, it's stressing, it's depressing, but I'm gonna keep on pushing by the grace of God. And I know the Lord that has brought me to this place is going to watch me throughout and is going to make sure I come out stronger. So yes guys, my light has gone off, but we bless the Lord because we've come to the end of this video. Yes, if you're blessed by this video, please send it to your friends and family. Encourage them to subscribe to this channel. This channel talk about everything medical school, lifestyle in Russia, in Moscow, and in Pirogov in particular. So yes, see you in my next video. Stay blessed until then.